Today I'd like to start by telling you a story about a young girl at the age of 12 who was diagnosed with depression. By the time she was 14, she was institutionalized and was diagnosed as bipolar or borderline personality disorder. This began a long road of many different diagnoses as well as many different medications that didn't help. By the time she was 21, she had married, had 3 kids, and divorced. When she was 23, she lost her children to the state for an attempted suicide. She continued to struggle to be happy and find somebody that could help her. When she turned 35, she found a doctor who found a knot on her throat and realized that this knot had been there her entire life and not one doctor had taken the time to check her thyroid. The doctor removed her half of her thyroid, and today she takes a hormone pill, and it has changed her life drastically. Today she strives to help other people who may be suffering just as she did. Do you suffer from depression? Do you know somebody that suffers from depression? Have you ever been diagnosed with any type of mood disorder? Do you know somebody that's ever been diagnosed with a mood disorder? In a 2012 study published in the American Journal of Psychiatry, it stated that thyroid abnormalities can induce mood, anxiety, psychotic, and cognitive disorders. Also noted in a 2014 study published in the Molecular Biology report, 75% of their patients that they tested with abnormal thyroid results. Those results showed low levels of free T3, normal levels of free T4, and high levels of free T3, reverse T3. These T3s are your hormone levels. Most doctors do not do a thorough exam unless they suspect that you have a thyroid disease. They only check your TSH or your TH4, or both. According to Dr. Lieberman of Beverly Hills, California, patients are often misdiagnosed with ADD, depression, anxiety, and other mood disorders such as bipolar. If they are misdiagnosed with bipolar, it is hard to get a correct thyroid result unless they are in a manic episode stage, because it's during this stage that their thyroid levels fluctuate. The story that I just told you was about me, and I'm here to ask you to help me save somebody's life, or possibly make somebody else's life better, improve somebody's health. Thyroid misdiagnosis is a serious problem, and there are so many out there who suffer just as I did, and it would mean everything to me to be able to help or save just one person. I ask that you take this time to look at these symptoms, and maybe you can help somebody that you know. Thank you. Let's change some lives.